Hey everyone, so with all the recent changes, I felt like I should give you guys an update, and I felt like it would be easier over a video as I'll be able to explain the schedule going forward. But for some administrative information first, in the past I've been answering questions on Instagram and other platforms, and I will try my best to do that. But to streamline everything, I ask all of you to please email me at this email right here, and it'll be linked down below. It'll help me field the questions a bit easier, and it'll keep everything in one place so I don't miss out on a message that you sent me and miss out something that's potentially important. Now, I will continue to put updates on Facebook, Twitter, and my Instagram story, but the main place I want you to contact me or get information from me is from the Google Classroom. The Classroom is going to be the host of all of the information, and for the most part, if you're in the classroom, you don't have to worry about being dropped unless you get an email from me. And so if I'm a little bit behind with some of the information, just hold on for a bit more. I promise it'll come out. And so the classroom will be the main place I'll be communicating with you. So just keep an eye out for information there, and you should be getting an email from the classroom whenever I post something. And lastly, if you are emailing me about the classroom, please include the name of the class that you're in and your group number. If you are trying to message me for something that is not related to the classroom, for pre-med advice or mentoring, you can go ahead and message me on Instagram still. I might take a bit to reply, but I'll try my best to reply in a timely manner. Okay, so let's go through the actual schedule. So initially we had planned to do our first virtual round session this Saturday and Sunday, but with some of the changes that had happened over the last few days, I'm going to push back those sessions to the next week. So instead, you're going to get a sample chest pain case that's going to come out on the 28th. And so I'm putting together that case right now. I'm going to send it to you, and you and your groups are going to go over it together and try to come up with a differential diagnosis for that person, for that patient. Try to come up with a diagnosis that is more likely, and discuss what some of the other findings you would find if you're thinking about some of the other diagnoses. Now, on the 29th, I will hold some office hours. I realize that a lot of this is going to be very new to you, and I am trying to get out as much information as I possibly can to prepare you, but you are inevitably going to have questions, and I do want to answer those questions if I can. So I'm going to hold an office hours like session from 3 to 5 p.m. PST on Google Meet. And so I will post the link in Facebook, on Twitter, and on my Instagram story. And I will also post that in the classroom. So it'll all be available for you. I will try to post the link prior to the actual meeting time, so you know that it's going to happen at that time. And if anything changes, of course, I will let you guys know. So how are the sessions going to actually change? Now, the original plan was to do the full case on the 30th and the 31st, but of course, because I want to give you guys enough time to actually learn the information, we're going to push that back to the next week. So on the 30th and the 31st, we're still going to hold the rounds day. And so on the first day, we're going to have 4 sessions, about an hour each, from 8 to 12, and I will give you the time that you and your group are going to be coming into that session. And then the same thing for the 31st. Now, for those sessions, for those 1 hour sessions, within your group, you're going to have to decide who's going to be the representative. And so once you decide who the representative is going to be, that person's going to be in the actual meeting, and they will be the one that I will be calling on. So for instance, if we're talking about a chest pain case and the patient is having something like chest pain with exertion and it gets better with rest, I would say something like, Dr. Nakvi, what do you think that is? Why do you think that's happening to the patient? And then so Dr. Nakvi would say, oh, well, maybe it's because he's having, angina symptoms. And I would say, yeah, great. So can you explain to me, how that happens? Why is it that anginal symptoms will cause chest pain when you're exerting yourself? And so it'll be kind of like that, where I'm asking you these questions, and you're kind of going to be in the hot seat, but I promise to do it in a nice way. And this is all for everybody's learning, especially yours. And I want you to get used to that idea of being in that hot seat, because you're going to be doing that during med school. And I want to make this as close as possible to the med school and residency experience. So what about those that aren't actually involved in the meeting? Well, these meetings are going to be live streamed to YouTube. And so within the live stream, I'm going to have somebody monitoring the comments, and they will transfer those comments to the Google Meet session, and I will be able to answer them there. Additionally, I would hope that you and your teammates are going to have some form of communication. So if you are stumped on a question, or you kind of anticipate a question and you don't know the answer, you can communicate with your team and field those questions and try to get the right answer just in case I call on you. And so having your team members available and watching the stream is going to be very helpful. Now, there might be some delay between the Google meeting and the YouTube live session. I do encourage you, though, to keep the stream open so that you can get whatever information you can from other participants while you are trying to discuss issues with your team. The second day will run the same way, and we will have 1 hour sessions 4 times on each of those days. Now, inevitably, there is going to be some delay. So if there is more than a 5 to 10 minute delay, I will let you guys know. Now, the information that I talked about right now was for the college students. If you are in high school, it's going to run a little different because I'm not going to live stream the high school sessions. Instead, what's going to happen is all the high schoolers are going to join the same meeting, and you should have a way to talk to your group outside of the live stream, and that way you can coordinate with each other and discuss potential answers to the questions I might ask you. And so in that situation, I'm still deciding whether I'm going to call you by your name or call you by your group. Either way, though, you should have some form of communication that is not going to be disruptive to the classroom. I hope that makes sense, and if it doesn't, feel free to ask me for clarification. So once we finish the sample cases, I want you guys to regroup with your team and kind of discuss what the thought process was behind what you had originally planned, see if that was any different from what happened in the actual case, and troubleshoot in that way, because that same process and what we're going to be doing during those sessions is going to apply to the big session, which is going to be on the 6th and the 7th. And so to prepare for that, I am going to send you a little bit of information about the final case, and you are going to discuss that case amongst your team, but also I'm going to send you another little group of 4 that you're going to work with. So within your classroom, you're going to be paired up with another group of 4 where you're going to talk about this case together. And the reason I'm doing that is so that when you go to the actual live session, you're going to have a teammate there with you that you've worked with and discussed your case with. And having 2 different perspectives is going to be very helpful, because if the second team thought of something that you didn't, well, you guys just learned something together. And so it's going to be important that you do coordinate and you do discuss these cases with that team. In the end, I feel like you're going to learn a lot from me, but you're probably going to learn more from your classmates. And that is what happens in residency and in medical school too. Between the 3rd and the 6th, I did not plan for any additional office hours. If the first office hour session was actually successful and was helpful, and you guys do want me to do another session, I can look at my schedule and see if we can schedule one, but we'll play it by ear. Now, on the 6th and the 7th, those sessions are going to run very similar to the sessions on the 30th and the 31st. So again, you're going to choose another person. So somebody that didn't go on the 30th and 31st, you're going to choose them to attend the rounds, and they're going to be your representative. Now, you're going to have a little bit more, you're going to have to coordinate a little bit more, because you're going to have to coordinate with the other person on the team, but that coordination is going to happen with the person actually in the meeting. Everybody else is going to still be on YouTube Live, and so the important thing with the 6th and the 7th is that you're going to have less information about the case. So you guys are going to go in almost completely blind, because the whole idea behind this is that you're going to learn a lot of information before the actual case, and you're going to be using that information that you learn to apply to solve a case together. And I will guide you through all of it, because I don't expect you to be at the level of a med student or a resident. So the way that these sessions will work is I will give the chief complaint. I will say the patient comes in with chest pain. And so after saying the patient comes in chest pain, I say, Dr. Sarah, what is your next question? And so Dr. Sarah will say, hey, what about when did the chest pain start? How long has it lasted? Is it constant? Is it intermittent? So on and so forth. And so if you need a little help on which questions to ask, the history and physical overview kind of went through some of that. And so we'll go through the history that way, where I will ask you what you guys want to know, and I will fill in the blanks if there's something crucial that you might have missed. I will be calling on you, but if there is something that you want to add, you will have the opportunity to do that. We just have to be respectful of others that are talking, so that we're not talking over each other. And we also have to be mindful of the time constraints. So that is something that we're going to have to balance, but I do want to make this as interactive as possible. Now, after the history, we're going to go through the vitals, and I will ask you, I'll give you the vitals and say, well, is there anything that you guys are concerned about? And you will be able to tell me, yeah, I'm concerned about the blood pressure being low, or wow, the pulse is really high. What can that mean? And if you ask me a question and I reverse it back on you and say, well, I don't know, what does it mean? It's me trying to test you, because you're going to be getting that in med school too. So we'll go through the history, the vitals. We're going to do the same thing for the physical, and I'm going to ask you after the physical, well, what labs do you want and what imaging do you want? After each of these sections, though, I will ask you what your overall differential is. And so I will go through go to the different teams and ask, like, so what is something you want to put on your differential? And we'll have a running list of the differential diagnoses that you want to add. And as we go through the case, you're going to tell me, well, a heart attack is less likely, pulmonary embolism is more likely, and costochondritis is not very likely, so we can eliminate that from the differential completely. And so you doing that, we're going to whittle down all the different possibilities into something that we think the patient actually has. And so from there, once we have kind of have it whittled down, we will go through some of the more specific labs and imaging and see if your diagnosis was correct. And there's no prizes or anything for it. It honestly is about getting to the right answer and not actually getting the right answer. And I feel like people learn more when they get things wrong, and the end goal of all this is to teach you the process of medicine and getting to the right diagnosis to help somebody. And honestly, the process is a lot of trial and error and a lot of error. But in the end, if you have a good system, you'll be able to help the patient. So after each of those sessions, I would want you guys to fill out the post quiz. So that's going to be very important to see how much you grew from the last 2 weeks. The post quiz is going to also help me tailor my teaching style to better suit your guys' needs. And so if I do need to change my style up, I'll be able to see it with the post quiz. The other thing with the post quiz is that if there has been no growth over the last 2 weeks, then there is something wrong with this format, and we have to kind of troubleshoot and figure it out. And so I might decide to spend another week or two on chest pain and cardiac issues, so that we can really dive deeper into it if I feel like we didn't hit what we were supposed to. So one of the reasons why I want to have you complete the post quiz as soon as you can after the live session is because I want to be able to go over it on the 7th. So on the 7th, after that last session, I'm going to set aside some time for people to come in and join me on a general meeting where we can talk about the quiz and talk about the specific learning points of each of the questions. So when I wrote these questions, I did it in a way where there's something specific to each of those questions that I want you to get out of it that will highlight the process of coming up with the right diagnosis and treatment. And so it's going to be very important that we complete those post quizzes as soon as possible. Now, if you're not able to attend that session, it is okay to turn it in a little bit later, but please do not watch the YouTube video of the post quiz review before taking the quiz, because I do want to see that growth. I want to see, did you learn enough so that we can move on from chest pain, or do we still need to take a little bit more time on chest pain, or is there something wrong with the learning style that I'm trying to put on display, or the way that I'm teaching? And so it's going to be very important to get accurate data. So try to do it as soon as you can, right after the meeting if you can. If you're not able to attend the meeting or if you're not able to attend the review session, it's okay to do it later. Just don't watch the review session before. So in the end, all of this is for your learning. This is all for your growth and for you to be able to see what it's like to be a doctor and to use these principles of problem solving to come up with the right answer to help your patient. And it's important for me to see that growth, and it's important for you to see that growth as well, because I can tell you from experience that when you're able to come up with that right diagnosis and that right plan, it feels really, really good, especially that first time. And for those that are on the waitlist or want to join the waitlist, I'll include the link below to sign up. But we are currently at capacity, so I will be letting you know if space does open up, and I will be emailing you. So just keep an eye out for those emails. The best way to participate and to be involved with the process is to subscribe to the YouTube channel and follow the live streams and comment within those live streams and try to solve the cases within that, because we will be taking some of those comments and putting them into the classroom. So you will have the opportunity to interact that way. Additionally, it'll help you prepare for when you are able to join the classroom. And if you have any questions about this, leave a comment or send me a message. I am really excited to get started with you all, and I hope this was helpful.